Good afternoon, everyone. I'm Shristi Salian from the Policy Research team of SarkariSchool.in, and I'm from NMIMS, and I've just completed my BSc Economics. And my partner is Mehak Lal. Hello,
Good morning,
everyone.
good morning, everyone. Mehak Lal. I am also from the policy research team of SarkariSchool.in. I am pursuing masters in economics from IGNU right now. I am also a chartered accountant and postgraduate in business administration, and I am also an economics graduate. Our topic of research is a comparison of school-based mental health service provision in Delhi and Mumbai. One of the most important concerns surrounding the growth and development of children is their mental health. According to the World Health Organization 2020, behavioral disorders are found to be the second leading cause of illness. Thus, there is a pressing need to address this issue. The mental health disorders includes all those disorders that relate to conditions like ADHD, ASD, depression, and anxiety. The causes of mental health issues can be the students that are studying in schools, especially those who are stepping into the adolescence, are at very high risk of falling prey to these mental health disorders. Some of these mental health issues stem from temporary challenges like death in the family, divorce of parents, conflict between friends, or migration to a new region. On the other hand, many children suffer from long term stressors that affect their mental faculties, like living in poverty, suffering from violence at home, bullying, or being homeless, or going through abuse. Now, coming to the literature review, it is important that the mental health needs of children are addressed as soon as possible, and the introduction of mental health services in schools is a really efficient way of doing so. Schools can help in the prevention, assessment, and intervention processes. It has been found that the availability of school counselors were better behavioral, physical, and emotional well being apart from good academic performance. These private benefits of the students could also have positive spillovers benefit over the parents, classmates, friends, and teachers of the recipient of the mental health services. The first credit in terms of establishing school and community based clinics goes to the Tata Institute of Social Sciences. The Central Board for Secondary Education, that is the CBSE, adopted the R.K. Raghavan Committee's guidelines and made it mandatory to have a trained full time counselor at each level of schooling: primary, upper primary, secondary, and senior secondary. The new education policy 2020 has brought about a monumental change in the education policy of India. The policy has placed high priority for the physical and mental health of the students. The help desk program under the Sarv Shiksha Abhiyan offers a Dropbox facility whereby children are confidentially getting support for their problems. In addition to the various policies adopted by the government, there are certain programs by the non governmental organizations, that is, the NGOs, which lay emphasis on the mental health promotion in schools. Now, the problems with the efficacy of the SBMS are that there are no comprehensive nationwide programs, the funding provided to them is low. Also, the main focus is still in the urban areas, and the role and duties of counselors are vague and undefined. Coming to the objectives of the research, the objectives of the research is that this paper aims to conduct a descriptive study to examine the efficiency of the mental health services that have been provided under various states and central policies to school children, and to help them have a better mental state and emotional development. It looks at two major Indian cities to compare the efficiency and impact of SBMS on the students. Other objective of the research is that aims to analyze if there are any differences in the impact of SBMS on the students depending on the kind of school attended as well as their socio-economic characteristics. Now discussing the sample description. The analysis in the descriptive cross-sectional study is done on the basis of sample of 107 respondents. The data was collected through the survey method using Google Forms to circulate the questionnaire. The data collection was targeted to students between the age of 14 to 18 years, that is the students studying in grades 9 to 12. The sample also has almost equal representation in terms of male and female genders. The sample is also divided equally according to the residents in either the city of Mumbai or Delhi. It is, however, does not contain an equal number of students from public and private schools. There are greater number of students from private schools as compared to those of public schools. This is one of the limitations of sampling.
Coming to the variables of our study, our dependent variable is essentially a score of the quality of experience while receiving the school based mental health services by our respondents. So, our respondents had to rate the services received by them in their school on the basis of 10 different aspects. So, these aspects included comfort with the counselor, accessibility to the counselor, the time allocated to each session, the trust with the counselor, the overall guidance and advice given to them, and the help in matters that are not related to school. And they also included aspects related to other mental health services such as workshops, so the frequency and the relevance of such workshops, the inclusion of mental health awareness in the curriculum, and an overall score for the school's effort to provide mental health services. So these were the aspects, and the students had to score them, and we had a score out of 100, which we use as a dependent variable. So our independent variables are gender, city of schooling, existing mental health disorders, number of counselors in school, the school type, that is public or private schools, the school board, the school fees, and the frequency of visiting the counselor. So moving on, we have our hypothesis. So, using our variables, we come down to two hypotheses, which is the city-wide comparison and the school-type comparison. So, in our city-wise comparison, we have a comparison between Mumbai and Delhi. And so, our null hypothesis states that there is no difference in the experience of the students while receiving SBHMS in the cities of Mumbai and Delhi. And our alternate hypothesis suggests that there exists a difference. Similarly, in the school type comparison, we say in our null hypothesis that there is no difference in the experience of the students of public and private schools who are receiving the mental health services from their schools. And our alternate hypothesis suggests that there exists a difference in the experience of the students of the two types of schools. So, to test this hypothesis, we move on to our analysis. So, for our analysis, we essentially had descriptive statistics and comparison of averages. And we also ran a regression where we regressed the cumulative score, our dependent variable, on other independent variable. We also used dummy variables because most of the variables in our study were qualitative in nature. We did not find any significant multicollinearity or heteroscedasticity in our data, and our regression model is specified as shown on the screen. So, moving on to our results and discussion, we see that we have a graph here. So our the graphs on the y-axis have average score of school-based mental health services, and on the x-axis we have the different categories. So in the first graph we have a school-wise comparison. So the first section shows the public school student score, and the second section shows the private student score. So in Mumbai, Mumbai is represented by the darker bar, and and Delhi is represented by the lighter graph. So here we can see that students of public schools have rated their experience much lower than students of private schools. In the second chart, we can see that there is a gender-wise comparison, and the first section is females, the second section is males. So the female respondents have, on an average, given a lower score to their experience as compared to their male counterparts. Next slide, please. In the third graph, we can see that we have compared across students who have frequently visited the counselor, which is the first section, and the second section is the students who have never visited the counselor. Here we can see that students who have frequently visited have had, on an average, a higher score to their experience. So this suggests that students who visit the counselor regularly are more aware of the facilities that are provided by their school, and thus they are more likely to have a better experience while receiving these facilities. Coming to the comparison across different boards, we can see that students of IB boards have the highest score on an average, while students of CBSE and SSC boards have the lowest score given. So next slide, please. We also have a regression results. So, just a glance at the coefficients, we can see that the gender coefficient, the fees, the frequency of visiting the counselor, and the number of counselor variables are all significant and positive. On the other hand, when we test the hypothesis, we come to our city and school type coefficients. And so, testing our first hypothesis, we have used a dummy variable approach here, and the students of Delhi were given a value of 0, and the students of Mumbai were given a value of 1. We look at the coefficient and we see that it's negative. So this suggests that students of Delhi have rated the services better than students of Mumbai. So, however, this relation is not statistically significant as the t value is not significant at the level of 10% of significance. So, we cannot reject our null hypothesis here. In our second hypothesis of school type comparison, we also have taken a similar approach. We have our private school students with a value 1 and the public school students has a value of 0, which is the base category. So we see the coefficient and we see that it's positive. So this suggests that private school students have rated the services better than public school students. However, again, this relation is not statistically significant and we cannot reject our null hypothesis here. But a problem here is because of the low number of public school students in the sample, this result could be biased. Moving on to our discussion. So, what we have observed during this whole research is that schools have been actually providing mental health facilities, but many of the students are not aware of these facilities, and that is why they don't avail these facilities. On the other hand, there are some students who feel scared or uncomfortable using these facilities. It is found that students who visited the counselor have had a favorable opinion of these facilities. This suggests that there is a need for more awareness programs and there's a need of having more sensitization programs that help in destigmatizing getting mental health. Moving on, we have our limitations. So our study, the level of our study, the scale of our study was very small. We had only 100 respondents and our country has a million students. So we have considered only two cities and we do not account for rural areas. Though this helps in concentrating the problems of these two cities, many other problems that may be particular to different cities may not be reflected in our research. Our research is also dependent on the self reported score of students, so it may contain a little bias. And our response from public school students was very low, so this could also affect our results. So, moving on to some policy suggestions that we come up with. And we also saw literature suggesting these. We currently see that a nationwide school-based mental health service program is not implemented, and it's implemented in a piecemeal approach in different states. So there is a need for center, state, and local government collaboration, and this can be done by implementing a central agency. We also see that there's a need for collaboration and coordination of different stakeholders in the planning and execution of this program. We also feel like there is a need for improving the training facilities given to counselors as well as teachers so that this program can be implemented better. And there's funding for this program is very low and often cut when budgets are reduced for schools. So we need to find innovative ways for fundings. Also, in our research, we have found that girl students have significantly rated their experiences lower as compared to male students. So we need to focus on the needs of these girl students and maybe increase the number of female counselors so that these girl students are more comfortable and they go and avail the facilities that is available to them. To ensure the future of the country is in safe hands, we need to work on the mental health of the students by providing them good mental health services in the school itself. So this will help our country develop and grow and have citizens who are of sound mind and able capabilities, which can help us in our growth and development. One thing that we have learned during this internship at sarkarischool.in is how to deal with these problems that not that we may not be facing necessarily, but students who are out there in public schools who might not have access to all the resources that we have are facing. And by this research and by conducting all these panel discussion events, it has given us a really clear explanation of what needs to be done for them, and we need to work towards building such a society where all of us are included and all of us have the opportunity to work together and help everyone grow. So thank you for listening to our presentation, and
Thank you.